Welcome to Filling You In, a dental podcast with A Squared, where dentist entrepreneurs and spouses, Dr. Anushka Gaglani and Dr. Abhishek Nagaraj, welcome industry experts and innovators to explore trends in business practices, patient care, career development, and what it takes to be successful in dentistry.
Hi, everyone, and welcome to another episode of Filling You In. I'm Dr. Abhishek Nagaraj.
And I'm Dr. Anushka Gaglani, collectively known as A Squared. Regular listeners to the podcast have heard many of our guests discuss the increasing presence of artificial intelligence in dentistry, but the focus has mainly been on its use for improving patient flow and operational efficiency. Today, we want to look at AI's role in patient care, including the development and approval of treatment plans.
For that, we turn to Dr. Wardah Inam, the co-founder and CEO of Overjet, a leading provider of AI technology for the dental industry, which in just a few years has already had an impact on making dentistry more clinically precise and patient-focused. Before founding Overjet in 2018, she led product development at a healthcare startup in biomedical imaging, and she's been ranked among the 32 most influential people in dentistry and listed by Inc. magazine as a top 100 female founder. Thank you so much for joining us today, Wardah.
Thank you for having me.
It's our pleasure. I want to dive in here and get a little bit of background. We'd love to have you add to that very brief sketch of your career so far and tell us how you ended up identifying the dental industry as a place you wanted to engage with.
So I think I entered dentistry as a patient. The good thing is it's something that everybody experiences and can relate to. So I had changed locations, so changed my dentist because of it, and got a treatment plan which was very different than I had received before by the previous dentist in a very short amount of time. And for me, I wanted to know more, and the more I learned, the more I obsessed about dentistry. So I got my X-rays, started reading Dental 101. Started looking at documentaries, reading books about this, trying to understand why there was variation of diagnosis and care that was happening. Like, how do I understand my oral health? And that journey ended up in me starting Overjet.
That's really interesting because only a scientist would think that way, right? Like looking at a problem and saying, let me dive deeper and actually learn about this field. So that's really unique and interesting.
Yeah, I would agree with that. So can you give us an overview of Overjet's capabilities on the clinical side and how it helps providers with diagnosis and patient care?
Absolutely. So the way I look at it is it's an assistive tool for dentists. Dentists, of course, are the final decision makers here. However, I think of it as how you have driver assist in cars, how you have other AI tools helping you in your day-to-day. This is helping you come up with a more comprehensive diagnosis and then communicate that diagnosis more effectively with patients. And I think that's the second piece, which I think resonates with almost everyone, where patients don't understand their oral health. They don't understand how to read X-rays, and X-rays is the modality by which dentists communicate with patients. And having a tool that can put annotations on it and markups and bring that X-ray more to life and have quantification so that people can start to understand their oral health. So rather than a dentist saying, hey, do you see radiolucency here? They don't know what radiolucency means, and and definitely not on tooth number 2. And being able to say, okay, look at this red area that's highlighted here is much easier for them to understand and then see the difference between what is being asked and what was there before as well. So I think it's one where it helps patients understand better and then helps dentists communicate more effectively, and then make sure that they have a peace of mind that everything has been looked at. There was nothing missed. Dentists do look at a lot of data very quickly while the patient is in the chair, and they're changing context a lot. They might be doing a procedure while the hygienist asks them to come into another room and not only make a diagnosis but communicate with patients, and that's just it's a high-paced environment where having AI assistive tools can really help.
Right on. Speaking of providers, what are you hearing from providers about its clinical uses?
So I think the interesting thing is, before ChatGPT, people wouldn't believe that this could do what it could do. And then, it was more like when we were sure, they were like, oh, no, not really. Like, does it work on it? Like, show me more cases. And there was more of this idea of like, what can it really do? And I think after ChatGPT, we've seen this like shift. Like, I think now people believe that AI can do this. And now the question is, how do they utilize it, et cetera, as well. So that's been a shift. So, and then in terms of the utilization, what we see a lot is for, on the diagnostic sides where, we've almost like every few weeks we get some dentists reaching out and saying, hey, I tried to present something, the patient didn't get it, and like after Overjet, like they got it instantly, and then accepted the treatment was very needed. Now it had turned into a crown. They could have just gotten a filling before, right? Like so
Right.
that kind of which is good for the provider because they get making sure that the right care is being delivered, and good for the patient because they're getting the care at the right time as well. So I think that's one of like how do for providers utilizing it to provide the right care at the right time. And then I think there's, especially for more inexperienced dentists who are right out of school, they're a little not that confident in their abilities. Like, did they really see it? They're not. And having something that, that's also something we find a lot with them saying, hey, I was kind of not sure. And like by this, I was more confident when I was talking to the patient as well. So I think those are like few like recent examples, but I think it's people have found very different ways of using it as well. Like what we didn't like originally thought of, some people have like automated their workflows more. Some people have used it as like, hey, hygienist, like, can you have a conversation with the patient to prep the patient before I walk in? So I think there's like been adaptation of by different dentists based on what they would prefer, and it's something that we learn from and try to then productize if it's something that we think more dentists can benefit from.
Yeah, it's
Absolutely.
so interesting you say that. The whole thing about ChatGPT coming out now and people are kind of like, oh, of course AI could do this, right? Because we see that for us with some of our more seasoned doctors, there was a little more of a pushback. They're like, well, I know I've read x-rays for X number of years. I can read them. Whereas the newer doctors who are right out of school, they are just hopping right into it. And they're like, I'm very excited by this and it's so useful. Of course, the seasoned docs have started to come around, but it's just interesting to see that dynamic.
Also, Anushka,
Absolutely.
I would add that, as clinicians or clinical directors or owners on the flip side of things, it's been able to tell us which of our providers are actually diagnosing at a really high level and which ones aren't. And when we correlate that data into their productivity levels, we're finding that the doctors that are diagnosing less or adopting AI in X-rays less are also actually not being as productive. So we're able to correlate that as well. So that's been
Yeah,
very
absolutely.
helpful.
And we have this graph, I don't know if you've seen it, which is like case acceptance versus treatment plan rate, and like being able to say, okay, are they not diagnosing what they need to diagnose, or are they not able to convert the patient on the treatment that is needed, and where does the guidance need to be shared with them on so that they can provide the best care for their patients.
Very good point.
Absolutely.
Yeah. So, Overjet conducted a survey of over 1,000 adults last year, in which only 55% of respondents reported a complete understanding of their dental diagnosis, and over a third reported feeling pressured into treatments that they weren't sure were necessary. These are pretty troubling findings. Can you help us understand how Overjet can improve this situation?
So I think over time, I think there's just like, I think it is changing as well. So first, I think the patient has changed. The patient of today wants to understand more. They're not just going to accept something. We are in the ChatGPT world. We are in where information is at your fingertips. You Google everything, etc. And unfortunately, again, because because x-rays are used and you don't have that much good like resources online as well on how to understand this stuff, maybe I think what patients have to rely on is the dentist to even educate them further. And of course, the dentist has so many other things to do, which is actually doing the treatments that are necessary, and diagnosing and running the practice and all the other stuff that they need to do as well. So I think there is this opportunity to like use visual tools, and Overjet being one of them, to help them understand more, and build confidence in this idea that this isn't just like I'm not pointing to things that you can see and now you need to nod your head that you can see it, but because you dentists get trained for many years to be able to see an incipient caries lesion. They get trained for years to see periapical radiolucencies, and it's one where we always do it in just non-dentists at Overjet as well. We like pull up an X-ray and say, okay, what do you see or something like that. It's just very hard, even people who've been around this kind of data. So I think it's basically giving them more understanding about the conditions, being able to visually see them. I think that makes a big difference. And then that building that trust, because it's not just the dentist saying it, because for X number of reasons, there's, if you go online, they'll be like, oh, because they wanted a Porsche, or many, there's like this misinformation that's out there as well, and characterization of dentists. And I think that's one where they can also not say, okay, no, it's not, just the dentist saying it. This is a third party AI tool, which is also like highlighting it and saying it as well. So I think that builds more trust between that patient and provider. And once you have the trust, I think it's much easier to convince somebody to do very painful treatments.
Absolutely. As a follow-up to that question too, Wardah, do you have any data internally that shows X percentage of patients actually will embrace AI versus just what a human is suggesting?
That's a very good. I don't think we have done a study around that. We've had very positive, so it's more anecdotal data. Like we get it, like it's a very positive responses. Like like even now we're seeing. I don't know if you've seen it yet, but like we've seen it on like if you look at Yelp reviews, Google reviews, you're seeing patients putting this in. As a thing about their dentist, saying, oh, like, my dentist is so cool because, X, Y, and Z, or I was able to see this, or, so I think, anecdotally, it seems there are patients who are positively receiving it and understanding it more, but I don't think we have maybe the other would be like, we have seen case acceptance numbers increase, so, we can correlated to it, but I think we don't have a like a direct study of patients saying it'd be good to like stand outside a practice and say, okay, you walked in, how many did
right, exactly.
Yeah,
clinician, at least my clinical mind's going towards if Overjet could show that there's 70% of patients will like agree with the data if you use your judgment in conjunction with AI, like that could be very cool data too.
Yeah,
like,
absolutely.
As you guys do more studies.
Great idea.
Thank you. Over to you, Anushka.
So I know interfacing with insurance plans is an important dimension of what Overjet does. Can you give us an example of how it works in that way?
Yeah, so I think, just going back to my experience when we started off, so not only did I get a different treatment plan, when when I asked the dental practice, hey, would insurance cover this treatment plan? They couldn't tell me. And I think that's where, for us, like as we started off, we said, hey, like if we really need to improve the care and experience in dental practices, we need to make sure that we look at it more end to end, because, the system dental or dentists provide the care, but insurance companies can impact the payment of care and payments in general. And how do we make sure that the right care gets delivered at the right time and people like get the treatments as well? And so we had this conscious effort of saying, okay, this technology doesn't need to, we can't create another technology the same way as like there's mistrust between dentists and payers, where payers are checking everything that the claims that are being reviewed, and on the dentist side, they're mistrusting the insurance companies, saying, hey, they'll just deny whatever, and they're just trying to make money as well. How do we give them the same language that they can speak, and have the tools which quantify the stuff? So like for us, quantification became a very important piece as well, because we can agree whenever there's like more mistrust, like you can subjectively disagree with each other a lot. But when it comes to quantified data and we say, okay, what is bone loss? Is it 2 millimeters of bone level? Is it 3 millimeters of bone level? And now once we've agreed, then it's a measurement, right? Like once we've agreed to the, and now the question is like, you could start to disagree on that, but at least we know we could speak the same language, rather than a dentist saying, hey, this patient needs scaling and root planing, and the pair saying, oh, there's no bone loss, So I think there is this opportunity to start to say that they speak the same language. And I think that's what Overjet has tried to do in the space. And we work with the software gets utilized by insurance companies now as well. It gets utilized by practices. That claim workflow is getting more seamless. We introduce what's called Review Pass. With a click of a button, get a decision by the insurance company, skip manual insurance review by the initial partners that we have now. We're testing that out and like trying to see like what all the value there is. And our goal is to get to more instant decisions. Like that's what we're trying to get to. Like how do we get more instant decisions so there's more clarity for the patient? They're walking away knowing that this will be paid, so they can make the right decision rather than like delaying care and not getting the care, because it might not seem like a lot, but like there are many people who cannot afford $400-500 a certain month, and they need to have that certainty that insurance will pay for them to get the treatment as well.
Right. That's really impactful, especially if you can get together with more and more carriers, right? Having to solve for predeterminations and waiting for 2 to 3 weeks, delaying care makes absolutely no sense. I think the practice and the clinician and the insurance company, they're all losing here, right? Because time is expensive.
Absolutely.
What level of market penetration has Overjet reached? And is there any other data you want to share that paints a picture of where Overjet's going or the impact it's having?
So on the impact level side, we serve about 115 million members, and we're in thousands of practices. We are, now in schools as well. So we are now contracted with 20% of the dental schools, and we're getting into, getting, young graduates to understand the stuff, understand how to practice with AI. And where do you trust it? Where do you, make your own judgments? What does that look like? So I think, having that in the curriculum as well. I think that's been an important part of it. We also, we started off with dental AI, and then we went on to like really building our imaging software, because we felt like, it needed to be end to end, from the capture all the way to the findings. AI can really help in the whole process of it and make sure that it's crystal clear quality. It's, giving the best findings and outputs, reduce costs because you're not paying for two softwares, etc. So that was like an important piece of it. Then we started going into like more revenue cycle management, around insurance verifications and review pass here. So we're getting to pre-treatment estimates. I think next for us is like automation of claim submissions, getting automated return backs. Like we think that this whole process can be fully automated, and then humans can do like the one-off things that might fall off. So I think that's how we like look at really reducing administrative overhead and really improving the care, so that you're getting exceptional care at a reasonable cost associated with it. Yeah.
Love it.
It's a lot. So what are your projections for growth in the next few years?
So for us, we are growing very fast. I think we're it'll be more than like 100% year over year for us.
It's amazing.
That's incredible.
Yeah.
We love to do a lightning round here. Anushka, you should lead with the lightning round.
Okay, so thank you. That was a lot of good information and so much value. But we'll do the fun part. What was your last impulse buy?
My last impulse buy. I don't buy that many things.
Why,
I don't know.
why don't we call it, what's the business decision that you splurged on that you're like, I'm going all in on this? Maybe substitute that.
I think AI. We're buying a lot of AI software. So the same way as like we think there's a lot of value internally. So we're splurging on AI software right now.
Impulsive, but not impulsive. Get it?
Yeah.
What are the least likely 3 words someone would use to describe you?
Huh. You have like tough questions here. Least likely, probably slow. Chill. And quiet.
All right.
Love it.
Well, seeing as how, all of the awards, the accolades, etc., I'd probably agree with those, definitely. What is your go-to karaoke song?
So right now, there's a song by Benson Boone, which is Beautiful Things. So my son loves it, and we are karaokeing probably every day. The song, him and I. He's 3 years old, and he knows half of the words. I probably know half of the words, but yeah, we're singing it every day.
Together you make it full. Love it.
That's so fun.
That's great.
So thank you so much for being with us today. We really appreciate your time.
No, thank you so much, guys. Thank you for having me.
I'm Dr. Abhishek Nagaraj.
And I'm Dr. Anushka Gaglani. Thanks for checking out today's show, and we hope you can join us again next time.
Thanks for watching this episode of Filling You In, where we uncover the insights, trends, and stories shaping the dental industry. If you like this podcast, please share it on your social channels and visit Areo Dental Group on LinkedIn or on Instagram @Areo Dental Group. You can also subscribe to the series and check out all of our episodes on this YouTube channel or at areodental.com/podcast. Until next time, stay curious, stay inspired, and let's keep elevating the dental field together.